Okay, so I'm going to kick off. We're still probably going to have some people filtering in, but for those of you who've been through this with us before, you know how this works. So good afternoon. I'm Margaret Mueller. Thank you for joining us for today's panel discussion. During the middle of March, as COVID-19 entered the Chicago community, a lot of businesses were forced to adapt and innovate and engage in brand new ways. And as a result of the pandemic, many Chicagoland area companies, particularly those in the manufacturing sector, found this to be a moment of action, working to contain COVID through scaling testing, PPE, equipment production, and medical supply distribution. So we are so excited that this panel of leaders agreed to share their lunch hour with us, as they are all companies that have been working around the clock to produce medical tools for patients, hospitals, and healthcare workers, and the world at large. Today, we are going to hear from Linda McGill-Boasmond, who's the owner and president of Cedar Concepts Corporation and also the chair of the Illinois Manufacturing Association. We have Alex Gourlay, who's the co-chief operating officer of the Walgreens Boots Alliance. We have John Groetelaars, who's president and CEO of Hillrom, and Lou Rassey, co-founder and chief executive officer of Fast Radius. Thank you all for joining us. Each of these leaders are going to offer insights into the ways that their companies have met this crisis head on and what the pandemic may mean for the future of the manufacturing industry going forward. And moderating today's conversation is Chris Wright, who's the managing director and CEO of ZS Associates. He's also a member of our board of directors here at the Executives Club of Chicago. Chris, over to you.
Okay, thank you, Margaret, and welcome everyone to today's panel discussion. What I thought we would do is give each of our panelists a chance to explain a little bit more about what each of their organizations do and the role that they have played in responding to the COVID-19 pandemic. So John, maybe we can start with you and what you and the Hillrom organization have been doing.
Yeah, thank you, Chris, and Margaret for having me join your panel today. Hillrom is a medical device, medical equipment manufacturer. We have about 10,000 employees around the world, a global company doing business in over 80 countries. Relevant to today's discussion, parts of our portfolio are really relevant for COVID-19 and the COVID-19 response. It wasn't too long ago where we were talking about ICU beds and ICU bed capacity and bed capacity in general, and you saw a lot of field hospitals being assembled around the country, including McCormick Place. Hillrom is the leading company that makes ICU beds in North America and in many countries around the world. And then also a major #1 player in other med-surg beds as well. So when it comes to hospital beds, Hillrom has a corner in the market, so to speak, one of the largest players in the business. But even more relevant to COVID, perhaps, was ventilators, and thankfully it's something that we don't talk about very much right now. But as you recall, shortage of ventilators was a real significant concern, in addition to some of the ICU equipment we talked about. So Hillrom's also a large manufacturer of ventilators, particularly ones that can go home with the patient and meant for mobilization of patients. Other products in our portfolio that are quite relevant is the brand of products known as Welsh Allyn by many of you is a Hillrom company. So thermometry, blood pressure measurement, vital signs measurement, and monitoring of patients is also a really important part of our portfolio. So all of those products really were directly impactful and needed in this crisis, and our employees were just thrilled to be able to participate and help in such a humanitarian crisis that we had. So that's a brief overview of Hillrom and the important products that were needed in this crisis.
Excellent. Thank you, John. Alec, how about you? Maybe you can tell us a bit more about Walgreens and the Boots Alliance and the role that you guys have played in the COVID pandemic.
Sure, Chris, and good afternoon, everyone, and thanks also for inviting me to the panel, Chris. It's great to be here. The Walgreens Boots Alliance is almost a global company. It operates in 25 markets, distributing drugs and running pharmacies and distributing OTC products. And again, I think we employ 400,000 plus people and 250,000 people in America, including 25,000 pharmacists. So our core purpose really as a company was to make sure that the pharmacies remained open and available at the start of the crisis and during the crisis, to make sure people get the medication required. And of course, on top of that, we had to make the place safe for our people. We had to make sure that we had all of the other OTC products required during that period of time, ranging from everything that was known at that time to some services that were not known that became obviously much more required, for example, testing during the crisis. It really pulled at the purpose of the company in the USA. The purpose of Walgreens has always been to be accessible and affordable. And again, our people were so motivated, really motivated to support each other and figure out the best ways to really help the supply chain work as best it could, get the goods, the services, and the drugs that customers and patients wanted in communities, and also respond, particularly as maybe the advice changed from the start of the crisis and the early time of the crisis, to make sure that we could give the best advice at the right time, and also start to stock new products really quickly that were required as that advice changed. So I'm incredibly proud of how Walgreens responded to this crisis. It responded in the mode it always has done, been there for communities in America when required, and really, I think, been available through the expertise, particularly of pharmacy and pharmacists during that period of time. So that's what we did, and that's where we are. And of course, we're still learning, and really look forward to the panel discussion today when we can speak about what we've learned and how we're trying to scale that, not just in the USA, but also in other global companies that we are part of.
Excellent. Thank you, Alex. Linda, maybe you could, today you're wearing kind of two hats on this panel, aren't you, right?
Yes, I am.
As the head of, as the head of Cedar Concepts, of course, but also as a chairwoman of the Illinois Manufacturers Association Board. So maybe you can share a little with the audience on what you've been up to.
So thank you so much. And we are also very pleased to be a part of the panel. Cedar Concepts, we're a chemical manufacturer located here in the city of Chicago. And quite interestingly, when COVID broke out, I actually was at the time in Asia. So we actually were trying to react from overseas and direct our people here. But being in the chemical industry, our employees typically always work with the standard PPE that you would work with. So that was not something that was going to be unique to them. But what we did find out that happened when COVID broke out was that typically sometimes people will go for what we call the non-name brands when it's not something very serious. But as soon as COVID broke out, immediately one of our clients, such as Clorox, that became the trusted brand that was out there on the marketplace. And we had to immediately turn around for a lot of our clients and triple, not and quadruple some of the amount of products that were going out the door. And also as part of the IMA, which represents over 4,000 Illinois manufacturers, we saw many of our manufacturers having to do the same thing. We heard manufacturers having employees actually staying and sleeping over at their facilities just so they could keep these production lines running to get polypropylene and other sorts of products, that we needed to make ventilators, masks, and other things. It was interestingly enough, as we were talking just prior to the startup of this conversation, our company used masks, and I actually had to turn around and ask my husband, who's a tailor, to start making masks for my employees. What we're going to see going forward, we saw many of our Illinois manufacturers. You heard of distilleries making sanitizers. We had the Flag company making uniforms and masks, and many different companies that had to switch on a dime their manufacturing processes to either quadruple or extrapolate to infinite numbers the amount of product and processes that they needed to change over. So proud to be a part of this panel and looking forward to discussing some of the changes that we had to endure.
Great, thank you, Linda. And then Lou, maybe you could tell us a little bit more about Fast Radius and the roles you guys have been playing.
Thanks, Chris. Fast Radius is a manufacturing technology company headquartered in the heart of Chicago. We work with manufacturing companies to help them identify, design, and manufacture their next generation of products, embracing the latest in manufacturing technologies like industrial grade 3D printing or additive manufacturing, as well as traditional technologies like machining and molding. So we're a partner across the life cycle to bring new products to the market. In the pandemic, we have shifted our engineering and manufacturing resources to help address the crisis. We've worked with a range of companies across categories to scale up production of existing products, but also to design and launch new to the world products, embracing these new tools of digital design and digital manufacturing. Much like Linda commented, we're one of the manufacturers who really shifted our resources to do what we could to help in the crisis. We've worked on products like ventilators, other medical devices, therapeutic equipment. We have designed masks and face shields and distributed those to communities that are in need. And we've also worked on designing and launching more complex devices like additively manufactured swabs. That is a new to the world product that was designed and launched in just a matter of weeks, again, to help meet the challenge in front of us here. Excited to be a part of the discussion here, Chris. Thanks for having me.
Okay, Lou, thanks so much. All right, let's get started. And Alec, maybe I'll start with you and we can talk a little bit about the beginning and the sort of the mobilization process that you went through at Walgreens once you and your team learned about the pandemic and how it was unfolding. Like, how did you get your leaders and your employees to understand what had to happen so that you guys could assist in this thing?
Yeah, it was a big moment. We're a very human company with over 400,000 people globally, and we have a joint venture in China. We own 40% of a pharmacy chain, a big pharmacy chain in China. So we had maybe a couple of weeks additional notice of the changes that were happening there before it became clear how we had to tackle this in America. And I'm very grateful that we had that 2 weeks. It gave us more time. But what became really clear to us was that we had to be absolutely communicating on a much more regular basis. And two dimensions to it, really. What is it the colleagues needed in the pharmacies to stay safe? And some of that stuff was available immediately, and some of that stuff took some time. So, for example, we decided early on to put perspex screens up between our people serving customers and the customers. But it still takes a few weeks to get that ordered and to get it in and get it fitted. But at least we were able to start early. Secondly, we had to communicate really clearly what was the advice of the government in the USA, the CDC. And that advice did change as the government became more aware of the issue. So, for example, face masks, or face covering, should I say, apologies, became a big change that happened. We saw that happening in other markets. So in advance, we were getting our supply chains ready, and we were able to, I think, get in stock for our people, first of all, so they could feel secure taking care of customers. And then we're able to make it available to other companies and eventually to customers. That'd be another example of where that advance notice and reaction worked. We also had to make sure that we communicated beyond our people to the communities that we worked in. So whether it be the various piece of really important social distancing show material that we had to get up and running very quickly, and sometimes that varied by state, often it varied by state, to be honest. We operate in every single state in the USA. And we did this through many channels, but the channel that we used more than ever before was the digital channel, for obvious reasons, because what became clear, again, maybe from a previous experience in other markets, was the digital channels really became very big very quickly. People wanted to know immediately how to take care of themselves or families and where to get advice from. And being Walgreens as part of a national pharmacy chain, we had to make sure that our information was up to date, up to the minute, and really helping patients and customers to make the right decisions for them and their family. So it was a daily meeting at the most senior level, chaired by the president of Walgreens, and it was also everything was a clearinghouse. It was a complete clearinghouse for making sure that there was no constraints. The team could do what they had to do and make decisions quickly to get things done. So it was a very different way of operating, to be honest, for us. And I'm, again, very thankful for the way the team tackled it. And there was nothing more important than communication, to be honest, Chris, because we were so required to keep our people safe, keep our patients informed, and to really keep up to date as the situation changed and the advice changed, let's say, from the government. So a big task, but we really learned the importance of communication and the importance of the digital channel during that period.
Excellent, thank you. Hey, John, how about at Hillrom? You had mentioned that of course, you guys are the market leader in hospital beds, but also in the production of ventilators and other equipment. How did you guys go about ramping up production so quickly?
Yeah, it's a good question, Chris. And, I mentioned earlier the parts of our portfolio that we saw significant increase in demand, as much as, 2 times. And in the case of ventilators, up to 5 times our normal production levels. So early in the crisis, we also, like Alex was saying, we saw signals from this both in China and then in Italy, and we knew it was coming. And we had a little bit of planning time to understand what parts of our portfolio would be in the highest demand, and understand that. So we identified about a dozen products in our portfolio that were going to be in high demand, that we saw, literally flying off the shelves in China and Italy. And this is where I think executive decision-making became really important. If you let and the communication that Alex was talking about being really rapid and transparent up and down the organization, really calling for an estimate of, we need to double production, right, in these 12 product areas, and we need to do it now. So what does it mean in a time where our supply chain was being rattled because of what was happening in China and in Europe? Not only secure our supply chain, but double it, and then hire about 300 new employees in our factories, which never stopped during this entire crisis. We have factories all around the world, in Europe and Mexico and the United States. So we had to, again, hire all those people, secure our supply chain, and make it even more robust through some excellent partnerships. I have to really take my hat off to a couple of large organizations that came to us through interesting, personal connections. Fiat Chrysler is one example, and Honeywell was the other. Both companies were fairly quiet during the crisis, right? They shut down their factories. They had a lot of great capability and talent, and they were looking for a way to help. So they came to us and said, look, we want to help you guys. We know you need to ramp up. We know you need to keep your essential operations running. How can we help? And we were, at first, it didn't take us long, but it took us a day or so to figure out, why do they want to help us? I mean, we're not used to this collaboration across industries. Right. But within about 24 hours, we said, yeah, we could use all the help we could get. And they were super helpful to give us that additional bandwidth overnight, introduce us to probably even some new suppliers that we weren't even aware of were out there that could help in the short term, but also the long term, as we scaled up production by about 2x in most of our product areas, and that I mentioned, and 5x in the case of ventilators. So that was really helpful, those partnerships. And we had to do all of this, of course, while working remotely. For those who worked in office settings, going to remote work, those who were showing up in our factories around the world, continuing to show up with new protocols of safety in place, and keeping our employee safety first and foremost, because if we were to lose our employees, we would need to shut down a factory, and we weren't even sure what the protocol would be of, would it take one illness and we'd have to shut down the factory? Would it be multiple illnesses? How would we actually do that? So we really broke up our management team into work streams around employee safety, supply chain, protocols for employees coming into the workplace. And another one was demand management, because of the areas of our portfolio that were experiencing high demand, we had to allocate inventory and allocate product and give a scheduled time of delivery that was credible to people who were panicking. Yeah. Whether that's here in the United States, on the East Coast, or on the West Coast, in other countries around the world who were absolutely in a panic to get our equipment. And we saw all the media back and forth between politicians and governors talking about ventilators and the chaos that was there. And it's true, there was a tremendous amount of chaos, and we had to have a central source of truth to manage and allocate our inventory and give credible timelines to customers so they could count on us. So, all those things were occurring. And, oh, by the way, at the same time, a DPA order came through from the Health and Human Services and FEMA to acquire under a DPA order ventilators from us and from many other companies. So never having dealt with a DPA order, we had to obviously learn all about that and learn how to respond to it and make sure that we were prepared for that as well. So, you know, a tremendous number of work streams. I think a couple of things that I would take away was that the candid conversation, the candid communication was essential. Constantly communicating to our employees that their safety was in the forefront of our mind. It was essential for us to continue to operate our factories, but also operate our service teams and our sales organization who go into hospitals on a day-to-day basis. And how do they do that more safely? Yeah. And how do they service equipment that needs to be serviced? And just breaking up those work streams into, you know, how to respond to that and how to triage those activities was really.
And John, in that escalation that you had in manufacturing, are you still running at that super high pace like that, or have things settled back down to something closer to normal for you guys?
No, we still are at the high pace. It took us a while, as you can imagine, hiring 300 people in some small communities like Southern Indiana and Batesville, Indiana, in upstate New York around Syracuse. You know, finding skilled labor took about a month and a half to find the employees, right, and ramp up, and then get our supply chains to respond. So we're still at an elevated level now, having just completed really completed the ramp up, and working through the schedule of deliveries that we had committed to. And we expect to stay at a higher level because we want to be prepared should but when a second wave comes. And what we should be talking about is how big that wave will be. Right. I think it'll be small ripples, and I hope there'll be smaller ripples, but not the huge wave that we saw hit the East Coast particularly. But we want to be ready for that too, so that we have available finished goods inventory to respond should that need occur again.
Great. Hey, Lou, you had mentioned, I think, that you had to ramp up production of face shields. Can you tell us more about that and the way you went about it?
Sure. This is one of the many products where we needed to, as an industry, quickly scale up production into the millions of units, ideally over the course of a matter of weeks, not months or quarters, which is the traditional product development and launch cycle. So what we did at Fast Radius is design from scratch a face shield that could be made using 3D printing or additive manufacturing, gathering input from medical professionals as well as others in the 3D printing community around the world, sharing design ideas, sharing what works, what doesn't. And over the course of just a couple of weeks, we had gone through several rounds of prototyping and validation and ultimately started producing products and getting them out into the field. Now I think we're approaching 1 million shields that are out supporting the cause here. I think what's striking about the pandemic here is it really did test the technologies that we have as an industry to much more rapidly design and launch new products. And face shields is a good example of that. I think the other thing that the digital manufacturing world we're now living in allowed us to do is to share insights and learnings. As John commented, this idea of collaborating up and down the supply chain, it was so true for us as well. We're a part of a global network in the World Economic Forum, and there were daily huddles with companies around the world, sharing design files, sharing insights about what's happening with different products that are being used, and just sharing notes and lessons and experiences to allow this speed of response. And so face shields, I think, is one example of that. For a pretty simple product, it's something that could be designed and manufactured and scaled pretty quickly. But a great illustration of what's possible when the need is there.
Excellent. Linda, you have about 4,000 members, right, in the Manufacturers Association that you had. There was so I imagine many different kind of products that are being produced, and of course, as hotspots were rising in different parts of the country, how did your members address that? How did they address what to produce, where to produce it, when to ship it, and so forth? Can you tell us more about that?
Certainly. Well, one of the things we saw clearly was overseas. It hit there first, and a lot of our manufacturers saw some of those docks being shut down quite early in the process. And so we, like anyone, those people who were well positioned had, more diversified vendor portfolios, were clearly able to move much more quickly. Also, where possible, wherever we could source clearly in North America, you immediately try to do sourcing from those types of areas. What I did see is a lot more supplier vendor coordination, much more closeness, I would like to say. As he said, at the end of the day, we're all human, and it became a human situation. And we were talking, even though we were talking across the water, it was, how do we get something over here now? How do we get something out of those docks? What is needed, to get material to our customers? And we were talking a little bit about, employees. You asked a question earlier. I just want to piggyback on, we were very, very proud of the fact that, we had over 99% attendance. And as we talked to some of our other Illinois manufacturers, we saw that they had also stepped up attendance as well. And one of the things was just really having those conversations with your employees to explain just where that product fits in the marketplace and why it is needed right now, right away. And people responded to that. It was a human thing to do. I think what we're seeing now is phase 2. Because I understand India has started to perhaps look at a second slowdown at their exports. And I know a lot of the products that we manufacture, especially in our industries, tend to be things that are from palms or different things that simply just don't grow here in North America. Mm-hmm. So again, having that supply source already secured or procured here in the U.S. much earlier. We're seeing that happening from many of our Illinois companies. Yes, some of them are still seeing some shortages. I think that's something that we're going to have to anticipate. But one of the things that we've been asked to do, and I've heard this from several of the Illinois manufacturers, is that we've been asked to step up and literally create several months supply right now. Mm-hmm. So that if as mentioned earlier, we do, and I hope we don't see that second wave, this material is ready, it's there, it's already prepared to put out so that the public is secured and, feels comfortable that, they won't run out of needed and necessary materials. So that's something that we've seen all of our Illinois suppliers do. I know you saw our Mark Densler, who is the head of the IMA, which is, a 125-year-old organization, there with the governor every day, speaking to people throughout, the state of Illinois, coordinating all of these manufacturers, how can we work together? Can someone over here connect with someone over here to make a product that is needed for the state or right away. So we saw a lot of that going on here within the state of Illinois.
Yeah, I think the amount of cooperation that we saw amongst companies during this pandemic was really terrific. I think we saw it all around, and hopefully if and when this second wave comes, hopefully we'll all be better prepared. That's for sure. But John, I had a question back to you on I think you had mentioned that people were kind of in a panic. They wanted to get they needed this equipment. Shortage of it. How did you guys navigate that? How did you figure out where to allocate the product that you were producing? Because there was still a shortage, even as you're ramping up the production. There's still a shortage. How did you deal with that?
Yeah, a couple things. I mentioned earlier assigning one of my senior executives to effectively oversee demand management and allocation of supplies, right? And our guiding principle there was make sure we deliver it to the places that need it most, and not to maximize our financial return, but really making sure that we could, number one, get the supplies there and know what our timelines were with global supply chains and having the global pandemic playing out. So we looked at really trusted data sources, whether it was the CDC or whether it was the Johns Hopkins database. Early on, one of my board members pointed me to the University of Washington IHME data that we probably all looked at by now. So we had, the good objective data to look at to see where the hotspots were, what regions of the world and what regions of the country really needed these supplies the most. Because we had to be the arbiter between, New York and Illinois, California and Illinois. And we needed to make decisions of getting the products to the people and the patients who needed it the most. And schedule our deliveries based on that. And at least we could always explain to our customers, this is how we're doing it. This is why we're allocating where we can. It would appear in the case of California, that they look like they might be hit early on. It didn't actually play out that way. So having a source of truth to inform our customers was really important when you had limited supply.
Yeah.
Obviously, we were ramping up production, as I mentioned. One of the things that helped us a lot was to take all of the various flavors and varieties of the products that that can be configured, and narrowing that down to 4 or 5 configurations, and then plowing ahead with production on those 4 or 5 configurations, so we can maximize the throughput of our operation. So those things helped a lot. And the one thing I would say, and it kind of speaks to what Linda was mentioning about the purpose and the ability for our teams to collaborate, whether within our own company or across industries, is reinforcing the important work that we're doing and reinforcing the role that our employees were playing to help in the crisis was immensely powerful. One of the things we decided to do early on was to make donations. And we did it in China, about a month before we did it in the U.S. And then when the virus came to the U.S., we donated about $5 million worth of ICU equipment to hospitals around the country, and did it in collaboration with the American Hospital Association. So, we wanted to, obviously respond on the one hand and deal with the crisis, but on the other hand, not lose sight of, our main mission in this crisis and what our company stood for, and leading with our heart, so to speak, in providing donations of needed equipment to hospitals around the country.
Very good. Hey, Alec, I had a question for you. It's not surprising with the scale of the Walgreens Boots Alliance that your organization's probably working with national health services and global emergency response sort of effort. I'm wondering, are there any interesting initiatives or specific initiatives that have arisen from the work that you're doing?
Yeah. The big conversation, we had a twice-a-week call across the globe. And in every country, including the USA, the big conversation was about testing, because every country was looking for a solution for testing, and every country really strongly believed that having that available in the pharmacy would be an obvious thing to do. And of course, the conversation in America started at the White House with all of the retailers, including ourselves, attending and signing up to drive-through testing. But what was really interesting was that it was a really complicated thing to do. So initially, the first thing is you've got a live virus. So you really don't want people who have got the virus or may have the virus coming into a location like a community pharmacy, even drive-through, where there is some risk of that to our people, but also importantly to the community we're serving. So we had to find closed stores. We had to find parking lots that were isolated. And we had to retrain our pharmacists to do what is quite a complicated procedure with quite a complicated nasal swab to do that properly. But again, I want to emphasize again, through this process, the partnerships were fantastic. We got calls, and Abbott in particular called us early on, and we ended up getting a point of care solution that meant we were able to speed up testing protocols and produce a drive-through pharmacy solution, which we did with many of our competitors, that became available quite quickly. The second thing was really about the antibodies and the serology and the antigens, and how could we have testing so that when people have had the virus, we knew they had the virus, they could be tracked and traced, and then they could be safely go back into the communities and do what they had to do for their lives. And that again is a fascinating conversation about how quickly we can scale to make that available through a network of pharmacies. And obviously with new point of care testing equipment, for example, rather than using blood draws, could you use capillary draws to be able to get the sample you need to be able to test for antibodies? And that's all work that's happening right now with many partners, and we're sharing that information with our competitors to make sure we get the right solution. So again, the testing was probably the best example of that. And next will come vaccines for sure, because again, you know, the ability to scale the vaccine to be able to do that en masse, we think is an opportunity for us to work collaboratively with our partners in the manufacturing area, with other competitors, and also with the hospital systems. So these are probably the two best examples of many that were really different to develop the role of the pharmacists and do things really quickly and safely to make sure these were accurate, safe, and credible.
Terrific, terrific. That's very, very interesting. Hey Lou, in 2018, I understand that your Chicago headquarter factory was named one of the 9 world's most innovative factories by the World Economic Forum. I think they referred to you as a lighthouse factory. Can you tell us more about what that distinction means and how that was useful during this COVID pandemic?
Sure, we're grateful for the recognition from the World Economic Forum. They've evaluated thousands of manufacturing companies around the world and have looked to identify those that are implementing Industry 4.0 technologies at real scale, not in a pilot stage, but foundational to their business. And that includes tools of digital design and simulation on the front end to reimagine how to design new products, but then also in the manufacturing work itself. And so for us, we're embracing industrial grade 3D printing, making parts for aerospace companies, medical device companies, consumer products companies to embrace these new technologies and their next generation products. And so we were grateful to be a part of the WEF Lighthouse community. And at the time, we were the only one in North America recognized. And since then, I think a couple more have come in to that network. I think it helped us in 2 ways. One, the community, as I mentioned before, was terrific in sharing lessons around the world about what was working and what was not. So we were sharing design files on a digital platform that all members of the community and beyond could benefit from. I think it's one of the sources of inspiration here, as the teams talked about, the level of collaboration, not just locally and within our own supply chains, but with companies and engineers and designers and manufacturers all around the world. And WEF created a wonderful platform for that. I think, but more fundamentally, the things that the World Economic Forum recognized in us allowed us to respond quickly in scaling products and designing products and then making them at real scale quickly. And I think for those who are maybe familiar with, may not be familiar with 3D printing, one of the benefits is the ability to design a part and make it the same day in production grade materials that you can actually use out in the market. As opposed to injection molding, you might design a part and then it might take you a month or 2 months to make the mold, get a part in your hand. And so in a digital age, we're able to rapidly design and manufacture, test, and then scale a product without going through those traditional long cycle product development processes. So what that has allowed us to do, as an example, in swabs with some customers and partners in the industry, including a company called Carbon, out on the West Coast, and Resolution Medical and others, over the course of just a few short weeks, noting the swab shortage and the traditional swabs we're all familiar with that have been around for generations and haven't fundamentally changed. We said, all right, those are in short supply. Can we create a 3D printed swab with a new material that can capture the specimen as effectively or more effectively? And we worked with a number of hospital systems and with material providers and the equipment makers, and a community really came together. And over a few short weeks, a product was designed, iterated, and ready for launch and testing. And now that product is being sold out into the market to fill this gap. With traditional manufacturing techniques, that takes months or quarters or years to get through that full process. And here in a digital age, we're able to do it in just a few short weeks. And now we can scale. And so I think the WEF recognition as an Industry 4.0 lighthouse, I think for us shines a light, not just for us, but for the industry about what's possible when companies are embracing these new tools that we have access to.
Yeah, no, the digital printing is just a fascinating development. And obviously will provide an opportunity to scale. That's terrific. Hey, Lynn, but of course, a lot of manufacturing is still done in more traditional ways. And Linda, across your whole membership, you must have a lot a very traditional manufacturer still. And I think you had mentioned the attendance rate was very, very high in people, on the production line. But how did your members, how did they go about expanding their production? How did they get more employees, in the kind of production that does require a good dose of labor to make it work? How did they go about expanding to meet demand?
Well, I think for some of us, while we saw items that were needed for the pandemic and we could switch over to those items, there were also some items that clearly weren't moving because of the pandemic. So we were able to utilize underutilized equipment. In other cases, we were able to secure, people to come in and work within the fields. Clearly, workforce training is something that's definitely still needed within the state of Illinois. I think even prior to the pandemic, the Illinois manufacturers had already identified approximately 30 to 40,000 positions that we could not fill because people had not yet been properly trained. Clearly, we work with, high schools, other institutes, and other entities within the state to try to bridge, that gap. As you said, a lot of our manufacturers still have their original facilities that have been around for decades. We just got through honoring one of our manufacturers that had been in place for well over 100 years throughout the state of Illinois. But you adapt. And I think that's what all of our manufacturers did, including Cedar Concepts. You had to adapt. You did what you had to do. Employees came in. If they had to quickly make dies, make equipment, a pandemic teaches you what you can do in a hurry and how quickly you can get it done. We saw that even from the U.S. government to expediting, certain things that would have taken perhaps years for them to approve, saying, listen, we've got to get this material out here. We need to get it out here now. This is how we're going to get this process to move much more quickly. We saw companies such as, I think it was Georgia Pacific, 120% because for some reason, a lot of people needed excess toilet paper. So, you saw people that, but we laugh about that, but that was a public concern. And whatever we could do to try to make people feel comfortable, not anxious. I'm working currently with the city of Chicago, and one of the things that they're looking at is moving forward is, what is this? How is this going to affect the city mentally, the people mentally? And they're doing a whole study, a whole training around how we're going to deal with this mentally going forward. So there are a lot of things that's going to come out of this pandemic. I was just reading that one of the things that I think we have learned is, and I think every nation has learned, is that a pandemic, no one can certainly rely solely on imports during a pandemic. And we're going to have to adapt. Not saying we should not have imports. We're a global society. We should remain a global society. But we are going to have to take a look at how we can manufacture, have the things that we need to do on a much shorter timeline. And whether that be looking at how we innovate new materials, I'm sure it's going to involve some sort of automation, robotics, as we were mentioning, getting 3D, getting things designed much more quickly to get it out into the public. Manufacturing, we've always been innovators, and we always adjust to the needs of the society, and we will continue to do so.
Hey, John, Linda mentioned some things getting fast-tracked. I think you had some products or some part of your product line that got fast-tracked by the government, allowing you to bring something to market more quickly than normally would have been. Can you tell us a bit about that and how that worked?
Yeah, we in mid-March, just as this was getting going, we announced we're going to introduce 5 new product innovations that were specific to modifying or improving an existing product or launching an entirely new version of the product for COVID-related needs. So those products range from a smartphone-based software change that was specific to a field hospital versus an acute care environment. But the one that required an emergency use authorization from the FDA was one related to one of our respiratory devices that really helps you excrete fluid from your lungs. And that's a very effective device. It's been used in the hospitals for many, many years. But one of the potential risks is that you could have aspiration of droplets with the device. So we knew of an improvement we could make to it to capture those droplets and have a closed circuit effectively and not allow for that gas exchange to occur. So we, within a week, put an application together, and within about 3 days got it approved at the FDA. So the FDA was, like Linda said, they're also being and continue to be very responsive in this crisis. The bureaucracy that normally goes at a 90-day pace is now going at a 2 or 3 day pace, and they've been working, over overtime getting these important products and improvements approved. So that was the one that went through a fast track approval. The other one I would highlight that is actually, I'm actually even more proud of is within a normal product development cycle time is about 2 years, 18 months to 2 years. In about 60 days, we launched a vital signs monitoring device for blood pressure, temperature, and oxygen saturation levels that was connected and allowed those vitals to be taken in the home or outside the hospital setting for monitoring COVID patients or even other chronic diseases, and allowing a clinical grade, multi-parameter vital signs device to be in the home and immediately transmit those results through an app to their physician or caregiver. So in the case of a COVID infected patient who you don't want to come to the hospital, but you want to monitor them, you could have a device like this in the home or in a long-term care facility and have that connectivity between the patient and the caregiver immediately with a high quality device versus a consumer type of brand product that you really, the measurements are nowhere near as accurate or trusted by clinicians. So that device developed in 60 days. We just announced the launch of that device this morning. And I think that device is, fits with telehealth, which will be certainly a new trend that's been accelerated greatly going forward, and really allow physicians to have the equipment they would normally have in their primary care facility in the home of the patient to monitor for critical conditions or patients who need to be isolated.
Interesting. So many new things have surfaced from this, haven't it? In fact, I thought maybe we'd move on to that. Maybe get your thoughts, each of the panelists' thoughts on the future and how the lessons we've learned and how that might affect your businesses and the world and our communities going forward. We hear this moniker of the new normal, and I wonder maybe John, if you can carry on what are some of the changes that you think that might become permanent, if you will, that we've learned because this was kind of thrust upon us these past few months?
Well, I think what we're doing now is a great example, and I think that will lead to a lot less travel. I think we're all learning because we're all doing it together at the same time. We're all learning that we can do this pretty effectively, and we don't need to travel as much as we used to, and it's actually pretty productive. So in an area for us that's even going to play itself out is in our sales organization and our clinical education teams, who now also have some higher restrictions to going into hospitals, that we're going to be doing educational events and sales calls and training activity online instead of doing it always hands-on. So I think that will also become more productive, having a bit of a command center where you have a center of excellence that can train and educate others via video conference like this. Telehealth, I mentioned earlier. I mean, this is effectively a version of telehealth, what we're doing now. I'm sure all of us have had, or our families have had a telehealth visit in the last 4 months because no one wants to go to a care facility as much as they wanted to in the past. It works pretty well. I think we're going to see that acceleration continue, and a lot of that's going to stick. We're looking, another example is we would typically have some very large sales meetings that we clearly won't be having in this environment. We would normally have those in the October timeframe. We're going to move to a virtual platform for that too, and find a way to get, not just 1,000 people, but probably a larger number of people on an all company-wide meeting that's online, and doing that globally. So I think a lot of those things around virtual training, education, meetings, and healthcare will going to play itself out. And in many ways, you know, I think we've accelerated the digital transformation of so many companies from what may have happened 5 or 7 years from now to being accelerated in a couple of months.
Yep, I agree. Linda, how about in the area of manufacturing? What do you think might be some changes that are going to be long-lasting for us?
Well, I think, first of all, we've seen policy changes and that were very much needed. And I think we're going to see those even improved upon as we go forward, you know, to allow us to bring product, you know, to the market much more quickly, much more effectively, but clearly maintaining the safety of the product that comes to the public. I agree. Clearly, you're going to see more people working remotely. That's definitely something that has worked for many companies. It's been effective. You're going to continue to see those types of things expanded upon. One of the things that I think you're going to also see with manufacturers is how quickly we can look at our own internal systems, you know, because we have a tendency to, as John mentioned earlier, to spend a lot of time moving something along, but this didn't give us a lot of time. And we found ways to standardize and yet get the product out there, have a safe product, and get it to the people much, much more quickly. So I think manufacturers have learned a lot in doing that process. We also are going to learn a little bit more about our supply chains, you know, and take a second look at those supply chains, because as I said, we're going into phase 2, and in phase 2, we're still seeing some struggles. We're not out of this completely. So we're going to continue to reevaluate those supply chains, and you know, what can we do differently? You know, what can we use that may be in our own backyards that we've ignored? Yeah. So I think those are the kind of things you're going to see moving forward.
Great. Alec, how about the pharmacy business and sort of the retail location, pharmacy-led kind of business? How do you think this is going to change all of that?
Yeah, I think for us, there's probably 2 things we think about. One has been mentioned a lot, which is this idea of digital transformation, which was happening already, but I think the acceleration, we call 10 years digital transformation in almost 10 weeks. And I'm not sure if that's right or wrong, but it certainly feels pretty good to me in terms of what's happening. And we call that digital magic, you know, artificial intelligence, agile supply chains, personalization of data, so that there's nothing more personal in your health or your well-being. So the ability of pharmacies to be able to really understand what someone wants from them and present the right product at the right time in the right way is really important. But the other side of the coin, we don't think will change as much, which is this idea of human contact, human interaction, the reassurance of a healthcare professional at the right time, or a pharmacist, to make sure that people really understand how to take the medicine, how to take care of themselves. So that bit will remain, that relationship will remain, but the change will be all in the digital side. The other thing for us is convenience. Convenience has been redefined. It's been redefined already. So, for example, we've had accelerate home delivery nationwide for both drugs and products. We'd accelerate what you get through the drive-through, which was the original convenience model for pharmacy of only 20 years ago, maybe even 10 years ago, to be honest. So I think the redefinition of convenience for consumers is going to be a big one. And last, and probably one that's even more interesting, is people have learned to live without a lot of stuff in the last 12 weeks, stuff they thought was important to them, and maybe is less important to them. And I think for both retail and healthcare, whatever that stuff is that you've learned to live without, and we'll have a different version of that. John's version, I think, was traveling. It's going to be very interesting to see how that develops in the months and years ahead, and how we all adapt our models to accommodate what people actually really want from life post-pandemic.
Very interesting. Lou, why don't I close with you? Any thoughts you have on how you see the future and what you've learned about your business and all of this during this pandemic?
I think the future of manufacturing holds incredible promise for really advancing the human condition in a way we haven't seen before in our history. This notion of a new industrial revolution or a digital age of manufacturing is here. And I think the pandemic has created some visibility as to the impact that is possible. An example is a notion of a virtual warehouse where prior to the pandemic, we have thousands of parts that we store digitally in the cloud, and our customers can order them on demand, and we produce them when they need them and the quantities that they need them in industrial quality that can go into a finished medical device or in service of an airplane or in service of industrial equipment. And that virtual warehouse has been building slowly, and it exists. Unfortunately, we didn't have ventilators in it. We didn't have swabs in it. We didn't have other medical equipment in this virtual warehouse, but guess what? Now we do. And if we fast forward 10 years from now, we'll have millions of products in a virtual warehouse that allow nimble allocation of resources to truly meet the demand in the market and respond to crises like this more effectively. I think as we take a step back from just the notion of virtual warehouse, I think, well, what does that mean? That type of digital infrastructure, what does that mean for how supply chains work? We think it creates an entirely new modality of transportation and logistics. So throughout human history, we've moved parts three ways: by ground, by air, and by sea. Now in a digital age, we have a fourth modality of transportation. That is moving parts through the internet at the speed of light and producing them proximate to where they're needed around the world in a micro factory that is fit and suited for that local market. There's no question that's what the world will look like 10, 20 years out. We already have a network of these micro factories operating that way today. It's a question of how does it scale? And so as this infrastructure matures, as the virtual warehouse gets larger, and as engineers learn what's now possible, I think there's tremendous promise for the ability of the manufacturing industry to respond to crises like this more effectively and to advance the human condition in all that we do together.
Fantastic. That's a very inspiring view of the future, and I can't wait to get there. So listen, Alex, John, Linda, and Lou, I want to thank you guys for joining the panel. I thought that was terrific, and really, I think the audience really appreciated all the insights that you had to share. And I'm going to turn things back over to Margaret.
Yes, thank you all so much for everything that you're doing for the Chicagoland community in the midst of COVID-19. And I know that it's starting to sound a little pat, but I am continually reminded in today so profoundly that COVID has been the great accelerator in so many ways. And many companies who are able to pivot and adapt quickly, they have the potential to come out on the other side of this even stronger. You're all a huge testament to that. Thank you for your leadership, your service, not only to the people of Chicago, but to our nation and the world. And we're all proud that your companies call Chicago home. Audience members, just a reminder that we have a COVID business resource page on our website to assist you and your organizations during this time. So just remember to check it out if you're looking for some resources. Thank you everyone for joining us. Be well.
Thank you. Bye now.